enjoyable. Now I'd like to ask Sante Guido Zanella, a doctor, an expert in chelation and nutraceutic therapy, who has for more than 10 years been studying detoxification from heavy metals and has put together a protocol for multiple sclerosis and neurodegenerative diseases. He's now going to talk about that today with us. Good morning, everyone. Welcome. Thank you very much for the invitation. Now, aluminium is one of the toxic metals. It's the third element most widespread on the Earth's surface, but it seems to have no useful function for the human body. Toxic metals are among the most harmful substances for man. Aluminium is never found in a free state, but in the form of compounds. The mineral which contains most aluminium is bauxite, which is a red rock from which aluminium is extracted by a complex processing, highly polluting process, especially in the first stage, which is called purification. This rock is treated with caustic soda so that the other metals present in bauxite are not dissolved, so they are eliminated by filtration, and the eliminated compounds take the name of red mud, which are responsible for many environmental disasters, as happened last year when a Hungarian village, Kolontar, was destroyed by a wave of 1 million cubic meters of red mud, highly concentrated in aluminium, because of the waste that had escaped from an aluminium factory. The red mud hit an area of around 40 square kilometers, and even worse, the mouth of the river Markel, an affluent of the Danube, as was reported widely in the press. Aluminium can be recycled virtually to infinity. Each time it's recycled, other substances which are highly toxic are produced and then need to be disposed of. The characteristics of aluminium are resistance to corrosion, high conductivity for heat and electricity, highly plastic, ductile, malleable, low radiating power, no magnetism, and a barrier effect. The main sources of contamination are food, first and foremost. Around 95% of the daily dose of aluminium in adults comes from food. The tea plant accumulates large quantities of aluminium. Then tools that we use for cooking, coffee machines and pans, but also packaging for foods, and all cans, drinks cans, and it's very dangerous to cook foods in aluminium foil, because this releases large amounts of aluminium into food. Flour and cake preparations often contain aluminium. A whole series of food additives contain aluminium, as does artificial milk and soya milk. Another source of aluminium is drugs. Many drugs contain aluminium. First and foremost, anti-acid drugs, aspirin, dialytic fluids, antidiarrheic drugs, and vaccines, which all used aluminium as an excipient. Drinking water, as we saw before, is a source of contamination, as aluminium is used to precipitate toxic substances in water. A recent study reported a 50% increase in Alzheimer's disease in areas with a high concentration of aluminium. And researchers have also found a risk of Alzheimer in people who drink a lot of water from aqueducts contaminated with aluminium. Above all, in the air we have contamination from pollution from aluminium. And cleaning products contain aluminium. Talcum powder, toothpaste in aluminium tubes, in industrial use in the aerospace industry, cigarette smoking and cannabis contain large quantities of aluminium, both in active smoking but also in passive smoking. So we need to pay attention to smoking. So why is aluminium so dangerous? Because it is a neurotoxin like lead and mercury, so these are metals which can potentially damage the CNS, leading to changes in neurons with the onset of severe symptoms. Oxidative enzymes will lead to motor deficits, and we will have a change in neuronal excitability. Obviously, these things vary from one individual to another, so absorption of aluminium is favored by a lack of zinc, deficiencies in calcium, magnesium, vitamin C and vitamin E, a deficit of vitamin D, and a deficiency of glutathione. The symptoms vary widely because potentially aluminium can damage all tissues. We have first and foremost the neurodegenerative diseases like Alzheimer, Parkinson, dementia, multiple sclerosis and so on. Aluminium can also have immunosuppressant effects, dialysis encephalopathy because of liquids contaminated by this metal. It can damage bones, it can lead to anemia, loss of appetite, headache, dry mouth, excessive sweating and neuromuscular disorders, osteoporosis, language disorders and many other problems. How can we diagnose heavy metal intoxication? Essentially, we have to use a substance called a chelating substance, because once the metal has penetrated our bodies and deposited within organs and tissues, it then carries out its damage. So simply by taking blood samples and measuring metal levels without a chelating substance, we have much lower values than those we will find when we administer a chelation agent. So the diagnosis is done with two tests. The first is a mineralogram of a hair, which doesn't require the administration of any chelation substances, and the test with the administration of chelating substances is the best test. We examine some hair specimens, and then there's a panel of heavy metals we test for to then detect and trace the metal. The most valid method of detecting heavy metals is to compare two urine samples before and after the administration of a chelating agent. The chelating agent we use by choice is EDTA, which is a synthetic amino acid, which is injected very slowly through a drip to enter the bloodstream, where it will find metals deposited and attract them, inactivating them, and eliminated them through the urinary tract. So basically the comparison between pre and post values will determine a diagnosis of intoxication. Here we can see an analysis. This is the first sample and the second sample. In the first sample, the first urine sample without the chelating agent, the result is 3.36 micrograms per litre. The reference value is up to 20, so apparently there is no intoxication. But when we administer the chelating agent, we can see how things change. In the second sample, collected straight after the administration of the chelating agent, we see 193, when the normal value should be below 20. So this is more than 9-fold higher the maximum reference value. So 20 is the top value, and values should be much lower. The same thing applies to the other metals that are tested. From 8.9, the range is up to 35, so apparently normal, whereas after administration of the chelating agent, mercury is 42 grams. So far in excess of the top value. Again, for lead, values rise from 13.7 to 41.2, so intoxication from aluminium and mercury in these analyses. This is the highest value I've ever found, 780 micrograms per litre, when the average value should be below 20. So here we have outright intoxication. Here we have another case, 439.9 instead of under 20. So these tests can be carried out by sending samples to the United States, and instead of testing the classic 4 metals that are tested in Italy, here they can taste a whole panel of toxic metals. And here again we can see intoxication from aluminium with 170, but also gadolinium. Gadolinium is important because we treat patients with neurodegenerative diseases, because gadolinium is the contrast medium that's used for magnetic resonance scans. So gadolinium should be expelled from the body on the days after the examination. What we are noting is that this gadolinium is deposited in tissues, and in the long term can also worsen the patient's conditions because it increases the toxic load of these metals. 15 years ago, the maximum value of aluminium found was 172. Today, we have encountered 770. But above all, 90% of patients today, after 10 infusions, still present very high values of aluminium, whereas when we started 15 years ago, after 10 sessions, we saw a normalization of the aluminium value. This means that aluminium is increasing in the environment, and potentially we are all at risk of intoxication. Another interesting finding is that we have discovered in recent years, when we started treating patients with multiple sclerosis, we found that in all patients tested had extremely high levels of aluminium. Multiple sclerosis is still unknown. Its cause is still unknown, but aluminium must be a concause in causing this disease, which is also reported in this 2006 article, where we saw that elevated urinary excretion of aluminium and iron is high in multiple sclerosis patients. Multiple sclerosis is the leading cause of disability among the young. It usually appears between the ages of 20 and 40, but can also affect children and the elderly, with a prevalence in the female sex, with 400,000 cases in Europe and 57,000 in Italy. The pathogenesis of multiple sclerosis is unknown, but the latest studies agree on a genetic predisposition, and environmental intoxication. So essentially we have damage to the brain-blood barrier with the passage of fibrinogen and other proteins to inflame the brain. Lymphocytes, T lymphocytes are activated with macrophages and other immune cells which attach the brain, generating large quantities of free radicals with the appearance of oxidative stress. Here we see a diagram of the hypothesis of pathogenesis of multiple sclerosis, with activation, adhesion, attraction and invasion of T cells crossing the blood-brain barrier with myelin damage to the myelin sheath in the central nervous system. So aluminium is a neurotoxin given its ability to damage neurons and the central nervous system. Now here we are helped by cell food, because cell food reduces this oxidative stress which is extremely elevated in multiple sclerosis. We can rebuild the store of micronutrients and for vital functions, making oxygen available without increasing the production of free radicals. Cell food has a biological antioxidant potential to purify the extracellular matrix, to stimulate immune function, improve muscle performance, and treat difficult wounds. It is an antioxidant with more than 30 times the optimal amount for human plasma. Cell food, as I said, will improve muscle performance, and it is extremely useful in all forms of multiple sclerosis. And moving on to very quickly to show you the effects of difficult wounds, which goes beyond this talk, but as you can see here, we see a deep ulceration on a limb in a patient with a friend of my wife who'd already tried every possible therapy to treat this wound. We tried a therapy of cell food diluted in saline for 6 months, and in 6 months this wound was healed. So the effectiveness of cell food in these cases too is extremely high. Most important thing is that all the components of cell food none of them contain gluten or yeast or doping substances, and therefore can be used for amateur and professional sports. But above all, it lacks acute toxicity even in case of overdosage, so the product can be managed with safety. Going back to multiple sclerosis, the main symptoms are fatigue, paresthesia, spasticity, diplopia, neuritis, ataxia, deficient sphincter control, dysphagia, dysarthria, and cognitive disorders. Extremely invalidating symptoms which reduce these patients to have recourse to helpers and carers for their daily functions. The classic treatment of multiple sclerosis are high-dose steroids, especially in the acute phase of the disease, immunomodulators and immunosuppressors to suppress the immune system, because as Dr. Speciani explained before, the immune system is of no use in these diseases, to make the immune system quiescent, and monoclonal antibodies are also used in the therapy of multiple sclerosis. These, in some cases, can also give rise to progressive multifocal leukoencephalopathy. Fortunately, in rare cases, can also lead to the patient's death. So, what we've learned that autoimmune diseases are all characterized by chronic inflammation associated with neuroendocrine changes that prevent the inflammatory focus subsiding. Virtually all patients with this disease have a deficient immunoendocrine response with a consequent difficulty or impossibility to reduce inflammation. And this is due to underfunction of the HPA axis, the hypothalamus, pituitary gland and adrenal gland, which leads to insufficient secretion of cortisol in response to stressor events, with lowering and flattening of the basal level of cortisol, as was described in this article. This is what happens. Here we see a physiological response to a stressor event. Here we see the green curve. We have the stressor event, the peak of cortisol, and then the physiological response shows the cortisol subsiding. But patients with an autoimmune disease have an attenuated response, which is prolonged. So we have a loss of what we call the rhythmicity of cortisol. Cortisol should have a peak, an acrophase in the early hours of the morning, and then the bathyphase, which we are when we try to lower cortisol in the evening. And this is important for the anti-inflammatory effect. So the aims of our treatment protocol are to limit the damage induced by chronic inflammation. We also have to integrate the system with buffer systems to combat acidosis, which is typically associated with chronic inflammation. And we also need to, acidosis, as I said, leads to damage, especially to bones and to muscle mass, because to compensate this acidosis, the body will remove the buffer systems from the noble organs, prevalently muscle and bone. So we need to buffer this acidosis to prevent damage, and then we need to reactivate the immunoendocrine systemic response, which is impaired in multiple sclerosis patients. So to conclude, our protocol includes detoxification in the first place to remove heavy metals, diagnosing heavy metal intoxication, adequate hydration. It's already been said that water is essential. So all patients we test have total water quantities which are very low. They are dehydrated, and this worsens their symptoms. So hydration is essential, reducing inflammation. We've already said that multiple sclerosis is caused by inflammation, so to reduce inflammation we prefer to use omega-3, using buffer systems to treat acidosis. It's extremely important to correct diet. We cannot just treat patients with chelation therapy or traditional treatments. We also need to see all the patient's habits, because food in this particular disease, a poor diet will worsen the condition. So we need to reconstruct the rhythmicity of cortisol, and above all we need to lower the glycemic load in the evening hours to prevent a rise in cortisol. We need to avoid short bursts of physical activity in the evening, because this too is a factor which will raise cortisol. So ideally physical exercise should be carried out in the morning, between 6, 9 or 10 in the morning, when we need to raise cortisol levels, and physical activity helps to lead to the cortisol peak in the morning. Antioxidants, we spoke of sulfode, deuterium sulfate, physical exercise and sleep. It is essential to sleep at least 6 to 8 hours a night to recover the muscle mass, because this occurs during the night if we manage to lower cortisol levels during the evening. Thank you for your attention.
Grazie.
Thank you, Dr. Zanella, for this very clear presentation of an extremely interesting topic from a social viewpoint, because here we're talking about multiple sclerosis, a neurodegenerative disease affecting 60,000 people in Italy, 400,000 in Europe. And we can see that this chelating agent, if intravenously administered, attracts the toxic metals and inactivates them. So the complementary treatments can be quite useful, as correctly explained by the speaker.